Good morning. I'm Dr. Meera from AVP Research Foundation. Good morning. This is Dr. Meera from AVP Research Foundation. Today I'm going to present a topic, salient features of leech therapy and its challenges. What we are going to see today is all those things regarding leech. So we'll go on. Yeah. First slide is salient features of leech therapy and its challenges. First, I'll just tell you what is leech therapy. In Ayurveda, it is called as Jaloka Charana. What are the contents in the sense? Like first is this the introduction of that, and all those contents will come indication, contraindication, all those things. So we'll look on to the contents first. Mitra, contents. Yeah. Contents are introduction of importance of blood. And next we'll go on to Jaloka, that is types and its special features, indications, contraindications, Jaloka Charana, challenges and solutions, conclusion. Next slide. Before getting into the topic Jaloka Charana, I would like to explain you what is the importance of blood. In Ayurveda, it is given that Dehasya Rudiram Moolam Rudireneva Daryate Tasmat Yatnena Samrakshya Raktam Jiva Idi Sthitihi. That is, it is clearly said that blood is our root of the body and it is sustained by blood. Our body is sustained by blood. Acharya Shushruta gives more importance to the blood. He considered blood as the fourth dosha. So it is very important in sustaining our body. It plays a vital role in sustenance of life. So it helps in strength, complexion, happiness, longevity, etc. This is the importance of blood. This quote is from Sushruta Samhita Sutrasthanam. Next slide. Yeah, introduction. What is Jaloka Charana? Jaloka Charana is nothing but it is one of the ancient effective bloodletting therapy in Ayurveda. That is called leech therapy. Normally called, it is leech therapy. According to Acharya Shushruta, there are 5 types of Shodhana therapy. That is Vamanam, Virechanam, Basti, Nasyam, and Raktamokshanam. In Raktamokshanam, Jaloka Charana is considered one among the bloodletting therapies. So in Raktamokshanam, there is Shastra and Ashastra Krit. In the sense, one which is done with sharp instruments, that is Shastra Krit, invasive method. And one more, Ashastra Krit is without using any sharp instruments. That is, all those Jaloka Charana comes under these Raktamokshanam. Jaloka Charana. The name Jaloka Charana. Jaloka in the sense, it is leech. It is known leech. Since Acharya Shushruta had given more importance to Rakta, it is considered as one among the Shodhana therapy. Next slide. Jaloka. We'll come on to the point. Jaloka. Jaloka Nirukti. How does the name Jaloka, the name came? Jalamasa Mayuriti Jalayukaha. Jalamasa Moka Idi Jaloka Saha. It is said that since Jala is the life of Jaloka, Jaloka is leech, it is called as Jaloka. Since they are habituated to water, it is called as Jaloka. Since Jala is their life, it is called Jala Ayuka. And since they are habituated to water, it is called as Jaloka. Next slide. Ayogya Jaloka. Okay, we know that Jaloka Vacharana need to be done with Jaloka. But we'll be having so many confusions that with which Jaloka we have to do, which type of Jaloka, which type of Jaloka, Desha the Jaloka must belong to, all those things we'll be having more confusion. So it is clearly given in our classical text that Ayogya Jaloka in the sense, the Jaloka which is not to be used, which is not suited for Jaloka Charana, that is leech therapy. Ayogya Jaloka. Leeches which are stula in their middle abdomen. In the sense, leeches which are stula, big one, which is very slow in its activity and which do not bite or which do not suck enough blood. All those things are considered as Ayogya Jaloka, which is not suited for Jaloka Vacharana. And one more thing, which is Visha. We have to identify which is Visha and which is non-Visha. That is, which is poisonous and which is non-poisonous. Based on that, we have to do the ideal Jaloka Vacharana therapy. If suppose, if we are not using it properly, like we are not selecting the Jaloka, which is non-Visha, it may lead to some complications, that is some challenges. Next slide. Okay. In Ayurveda, there are totally 12 types of leeches, 6 types of Savisha, and 6 types of Nirvisha, that is 6 types of poisonous Jaloka and 6 types of non-poisonous Jaloka. Now we look on to Savisha Jaloka, that is poisonous Jaloka. There are totally 6 types here: Krishna, Garbura, Alagartha, Indrayudha, Samudrika, Kochandana. These names, all those things are given based on bodily features of leeches. We'll see one by one. You see the first one, that is Krishna, that is black in color. Anjana Churna Varna, that is, this first type of Jaloka resembles in the sense there are more leeches which gives the resemblance of some animals or some flowers, etc. First type, Krishna, tells you about the color of the leech, that is Anjana Churna Varna, black in color and which is big headed. Next one, Garbura. Garbura, it looks like Varmi Matsya. Varmi Matsya in the sense it's a type of fish. Matsya is fish. And its bodily features are abdomen is segmented and it is bit bulging. So this is the characteristic features of Garbura type of Visha Jaloka. Third one is Alagartha. Alagartha, which is hairy with big flanks and black mouth. Most of these type of Jaloka, it is somewhat rare to see and we can't it is not usual also, but for this differentiation I have made all those things. So Alagartha is hairy with big flanks and black mouth. Next it is Indrayudha. Indrayudha is Jaloka which is having a black stripes on their body, that is Indrayudha. Next one is Samudrika. The name Samudrika itself tells you something, resemblance of flowers like that. So Samudrika is slight blackish yellow, have marks resembling many flowers on their body. Next one is Gochandana. Gochandana resembles scrotum of bull and it is small mouth and it is having small mouth. That is Gochandana variety of Visha Jaloka. So we have seen 6 types of Savisha Jaloka: Krishna, Garbura, Alagadda, Indrayudha, Samudrika, Gochandana. Next slide. Next, we are going to see Nirvisha Jaloka, that is devoid of Visha, non-poisonous Jaloka. That is of 6 types: Kapila, Pingala, Shankamukhi, Mushika, Pundarikamuki, Sabrika. These all are the non-Visha types of Jaloka. We'll see one by one. First one is Kapila. Kapila, it resembles the color of Manashila. Manashila is nothing but it comes under Uparasa. To tell it shortly, that is some arsenic components. Realgar. Realgar is the Manashila. In Sanskrit, we'll tell Realgar as Manashila. So it is Manashila colored and it is unctuous, which is more snigdha. And the color of Kapila leeches, color of Mudga. Mudga means green gram. Second one is Pingala. Pingala, which is red or brown in color and which is round in body shape and it moves quickly. And Shankamuki. Third one is Shankamuki is brown color and it sucks blood quickly. Mouth is long and penetrating. That is Shankamuki. Muki in the sense mouth. So this is third one. Next, fourth one is Mushika. Mushika in the sense we all know that it is a mice. Mushika. So it resembles the color and shape like that of mice. And it also has foul smell in it. Next, fifth one is Pundarikamuki. Pundarikamuki, it possesses the color mudga, same like our green gram. But its mouth resembles the lotus. Uh, you can see the pictures in the beside. This resembles the mouth. It resembles the lotus. The mouth of this particular leech resembles the lotus. Sixth one is Savarika. Savarika is unctuous and its color it resembles the color of petal, and the most important thing is it is 18 angula. It is 18 angula in length. It is 36 centimeter in length. So we have seen Kapila, Pingala, Shankamuki, Mushika, Pundarikamuki, and Savarika. These all are these non-Visha Jaloka. Next slide. Now we will see who all are indicated for leech therapy. That is Jaloka Charana. Who all are indicated? Patient who suffers from kushta, that is sorry, patient who is suffering from kushta. One sec. Now we'll see the indications. Patient who is suffering from kushta, that is skin diseases, visarpa and erysipelas, and vatarakta, that is gouty arthritis condition. Gulma is something like abdominal tumor. Vidrati, it is merely like abscess conditions. Kantu, it is itching. Budaphaka is abscess in or suppuration in anal region. Indralutta, like baldness condition or patchy loss of hair. And Arshas is like hemorrhoid conditions. These all are the indications given. According to Charaka, Shushruta, and Vakpata, it differs. These all are the few indications, and it depends upon the of the physician who is giving the therapy. According to Charaka, Shushruta, and Vakpata, few diseases are given and few it is not given. You can just have a glance over this tablet column. Next slide. Now we'll come into the contraindication part. That is who all are contraindicated for Jaloka Charana. Who is suffering from Sarva Angashodha, that is a type of edema, full body edema. Pandu, anemic patients. Vriddha, who is old aged. Shatakshina, who is very much weak. And Shosha, who is emaciated. Murchita, who is having giddiness or tired, etc. And Garbhini, who is pregnant. These all are some of the contraindications given in the text, etc. There are so many contraindications also, but I have listed only few. Next slide. Jaloka Vacharana. We have come to the main point, Jaloka Vacharana. Before doing the therapy, we have to know how we should collect the Jaloka and how it must be maintained and how we should apply it to the patient. There is certain karma, in the sense Purva karma and the main course, and next it is Paschat karma. Purva karma is preparatory methods. What all are the preparatory methods? First of all, we know which is the Visha type and which is non-Visha type. So where do we collect all those leeches? We have to collect the leeches from fresh lake pond or something, which is very fresh water. We have to collect from there. So how you can collect the leeches in the sense, you can just give a meat, or you can just a leather you can use there, and you can just a leather thing you have to insert in lake or something pond, and with the help of all those moist leather you can just collect the leech. This is the collection of leech. After collecting the best quality leech, we have to see we have to be very conscious about leech migration all. So it is better and best to collect using the glove. Before using the glove you have to give a proper wash to the glove, then you have to collect the leech. Next, after collecting the leech, we have to wash it with turmeric. It is, you all know, it is manjal. So you have to wash it with turmeric in a water. After that you have to give a wash with the normal water. After that you have to place it in a container which is having lids, a hole in the lids. So for better circulation for the leech, it helps it. So you can just collect in a container, or pot is well and good. So once in 3 days you have to change the water, and once in 7 days you have to change the container. We have to notice whether the leech is ventilated properly or not. Next, we'll see how method of application of leech. After collection, all those things, collection and maintenance of leech, we have to select the ideal patient to give Jaloka Charana. Before leech application, we have to check into bleeding count, bleeding time, clotting time, HP, and ESR of the patient in order to avoid anemia, infection, like allergic reaction condition, etc. These all are some of the challenges we'll be facing. So it is better to check BT, CT count, HB, and ESR. So we should make next, after checking all those parameters, whether the patient is suitable or not, then you have to make the setup for Jaloka Charana. Then the leech is allowed to bite the deceased part. So if the leech is not catching that area, we have to rub the area with blood, ghee, mud, or sometimes you can just make an incision over that, so that it is easy for the leech to suck the blood. So we can see which is the proper sign of sucking blood. In the further slides, I'll show you the picture. Like how we can identify that the leech has been started sucking the blood, in the sense, the leech mouth, it looks like a horse hoof, and it starts raising its shoulder and shaking its head. All those things you have to notice keenly, and then we can just identify. Next slide. These all are the few collection methods. You can just have a glance over it. The first picture, using gloves, we have collected the leech. After that, it is washed and it is collected in a container where the lid is having so many holes for blood circulation, etc. Yes, we have stored. This is what I said you. The turmeric powder in water is to for the cleansing of the leech. Next, this is the thing what I said. The leech, when it starts sucking the blood, the mouth of the leech looks like a horse hoof. Next slide. These are the few things we have to look into the matter very seriously. That during leech therapy, we must be very conscious that whether leech is getting migrating or not. Then after the leech therapy also, there is certain things to be followed. Like, it is not to be pulled directly from like directly using the hand, etc. So we may get some complications or all those things. Next slide. This is after leech therapy. The leech is supposed to vomit all the blood so that the same leech, after purification, I mean after vamana of leech, it can be used again for the same patient. We have to note carefully that the leech must be used for only one patient. The leech which we are using must be used for one patient, and it is not advised to use for another patient. So it is better to label the container with the patient's name or ID, etc. Next slide. Indramada exhaustion or dice stiffness. When proper shodhana is purification of leech is not done, it causes Indramada, that is some giddiness like conditions, exhaustion or dice, stiffness of leech. These all are the complications of leech. Next slide. Why do we select the Jaloka for sucking? Sampriktat drishta shuddha asra Jaloka dushta shonitam आदत्ते प्रथमं असः हंसः क्षीरं क्षीर उदकादिव सम्पृक्तात् दुष्टशुद्ध अस्रा जलौका दुष्टशोणितम् आदत्ते प्रथमं हंसः क्षीरं क्षीर उदकादिव. What it is given in this shloka is Jaloka helps in sucking the impure blood, just like how the swan separates milk from water. In that way, that is Adatte Pradhamam Hamsah Kshiram Kshirodakadipa. So it sucks only the impure blood. Mode of action is, how does it work? Hirudin. This is saliva content present in the leech. This saliva content contains a variety of bioactive components that it possesses anti-inflammatory, anticoagulant, anesthetic, vasodilator, antibiotic, and antioxidant properties that functions in various conditions of illness through multiple mechanisms. So saliva leech plays a major role in this leech therapy. Hirudin. This is one among the saliva content. There is a lot of saliva content. This is just one single example. There are many bioactive constituents such as hirudin, calin, destabilis, etc. These all helps in various purpose. So it helps in normalization and improvement of capillary circulation. It is also anticoagulation, anti-inflammatory effects, antibacterial effect. It possesses all those quality. Next slide. This is infection. What, as I said previously, when we don't see such factors, such parameters like BTCT, HPESR, so it may lead to some infection conditions, like if it is not done properly. When the leech inadvertently regurgitates gut contents into the wound, so it may cause infections like septicemia, cellulitis, meningitis, like conditions. Management is, it is usually sensitive to third generation cephalosporins, and you can just give aminoglycosides, etc. All those things. Next slide. So we have to note into the HP count also, or else, like in anemic conditions, it may worsen the condition, like it causes coagulation disorder, etc. Management is a transfusion of fresh frozen plasma, etc. In Ayurvedic, we have so many aristams, asavam, and intake of amalaki, etc. pomegranate, etc. Next slide. This is one of the major thing, that is leech migration. So physician who is in charge of the therapy must be very conscious about leech migration. We have to check on whether the leech it is in a proper position, whether it is sucking the correct place. After the leech is made to bite on the infected area, we are supposed to uh, apply or cover it with the wet cloth, so that the leech migration, all those things could be avoided. Leech therapy, like Jaloka Charana therapy, is very safe method, and it may lead to some challenging conditions like anemic, septicemia, etc. When there is no proper guidance from the physician. So it depends on the physician. If left unattended, the previous slide, if left unattended, the leech starts wandering in search of a new place to rest or feast. Management is gently detach the leech and try not to squeeze the leech. Next slide. Allergic reactions. As I said, if it is not given proper guidance, it may lead to some mild itching, swelling, rashes, etc. Next slide. And solutions. Proper bloodletting. After proper bloodletting, one is supposed to apply Shatadauta over wound or cotton swab soaked with this krita be kept over wound. If there is improper bloodletting, what all the things we have to follow in the sense, when it is bloodletting is deficient, we have to rub the wound with madhu, buddha or haridra. When it is done excessive, cold bath or cold pack. Then it is done faulty, it is done wrongly. Application of astringent, sweet, cold drugs with unctuous drugs. Or else we can administer with the internal medications like Mahagada, it is anti-poisonous recipe, and Lepas in the sense paste like Rasnadi Churna, Jadamayadi are given. Or Shodhahara drugs, etc. are indicated. The previous slide. Previous slide. Previous. Leech migration. So in this picture, you can just see when it is not guided properly, it may get into the eye or nose like this. The most complication never occurs. So the guidance of physician is more important in this conditions. Next slide. Conclusion. Now we are coming to the conclusion part. To err is a human, but unintended leech bite is also a reportable medical error. So it is our responsibility to administer leech therapy safely. It is necessary to note that success of leech therapy depends not only on biologically active properties of the saliva, but also from the experience of doctor and joint action of the patient and doctor. Proper knowledge about Jaloka, identification of leech, and maintenance of complications are needed to get success in Jaloka therapy. Sadly, most bioactive ingredients are still unexplored, but extensive studies are therefore needed to find out the precise mechanisms, etc. So, I have given you the overall view about the Jaloka Vacharna leech therapy. These all are the reference. Sushruta Samhita Sutrasthana, Ashtanga Hridaya Sutrasthana, Ashtanga Sangraha, Sharangatara Samhita. These all are the reference. So for further details, these all are the reference. Thank you.